Hi, welcome to J Sweat Plastic Surgery. I'm Dr. Jeffrey Sweat. You're being asked to watch this video today as a general introduction to the practice. It is our goal here that you are taken care of in a state-of-the-art facility, but also that we make sure that you're comfortable and that all of your questions are answered. This is definitely a team approach. As an individual surgeon who operates anywhere from 3 to 4 days a week, I rely on my team around me to help with your care throughout the entire process. I've also surrounded myself by people who are highly educated about what we do, so oftentimes they will answer your questions. If you have any questions that they can't answer, obviously they'll talk to me and we'll make sure that we have all of your questions answered. But it is important to understand that it is a team approach, and oftentimes throughout the surgical process you will interface with me from time to time, but you will often interface with my staff more frequently than you do with me. And this is so that we make ourselves available to you at all times and any time that you have problems. Obviously, we will provide you with an emergency number that you can call after hours, but when our office is open, it is always best to call the office to get the fastest response. If you have any questions or concerns about the process and how we are taking care of you as a patient here at J Sweat Plastic Surgery, please don't hesitate to ask. Thank you and welcome to the practice. The purpose of this video today is to talk about body contouring surgery, but more specifically, tummy tucks, extended tummy tucks, and body lift surgery. In a way, these surgeries are all very related, which is why we're having you watch this video that's going to discuss all of them. Based on your physical exam, we have made specific recommendations for you, whether that be a traditional tummy tuck that usually extends from about hip bone to hip bone, or it be an extended tummy tuck that extends even further, but not all the way around the body, or a body lift surgery in which the incision will be carried all the way around the body and it will treat the excess skin and fat and abdominal wall laxity that is involved in a tummy tuck, but also lifts the lateral thighs and the buttocks. The main purpose of a tummy tuck surgery, again, is to remove excess skin and fat. When people have had massive weight changes through weight loss or pregnancy, they can have stretch marks and stretched out skin of the abdominal wall. They can also have laxity of the abdominal wall. And the reason that we're doing this surgery is to tighten the belly wall once again and to remove the excess skin and fat that is left behind from the weight loss or the weight fluctuation. That involves making an incision that goes super low, that extends again either from hip bone to hip bone or beyond the hip bone. We're trying to keep it as low as possible so that it could be hidden at least in the front side through underwear or a low-cut bikini. It is important to understand that the abdominal wall tightening tends to make more of an hourglass figure. So in men who undergo body contouring surgery, more specifically tummy tuck or lower body lift, oftentimes we're not tightening the belly wall in order to avoid making a feminine contour. With women, we're trying to give as best contour as possible. Oftentimes with tummy tucks, we're doing additional contouring where perhaps we're doing liposuction of the love handles to give a better contour afterwards, unless we're actually doing the body lift surgery, which physically removes the love handles. With the body lift surgery on the backside, also known as a lower body lift, we are actually making the incision up in the area where the love handles are. So the incision on the back side tends to get a little higher than the incision on the front side. But this is to give a better contour and not remove part of the buttocks in the course of the operation. With liposuction, what I'm doing is taking a metal rod about as big around as my pin, and I'm passing it underneath the skin in the areas where I've opened the abdomen for the tummy tuck surgery, and trying to remove the fat as evenly as possible. If too much fat is removed in one spot and not enough in another, there can be contour irregularities, dents, or divots that can require further surgery in order to fix this. It is important to understand that while the tummy tuck or body lift surgery is physically tightening the skin, liposuction does not tighten the skin. It simply removes the fatty tissue that's underneath the skin, and thus there can be rippling or denting of the skin or skin laxity after surgery. And basically, we've made the recommendation on whether or not you should have body contouring surgery or liposuction based on your own physical exam. It is important to understand that when we're doing body contouring surgery, we're pulling things as tight as we possibly can. Now, with a tummy tuck, when you wake up from surgery, oftentimes you'll be flexed at your hips about the same as what I'm sitting right now, which means that you're going to have to walk bent over and you're going to have to sleep with your hips flexed until things relax and you're able to stand up straight again. The more tension or more pull that I place on the incision, the more the incision tends to lump up or thicken with time. And that's why we hide the incision super low so that it can be hidden, again, either in underwear or bikini so that we're not seeing the incision. The trade-off of doing the body contouring surgery is the scar that is left behind. Over time, again, you're going to be able to stand up straight. And if I do an incision that goes all the way around, it is important to understand that I can't put tension on the incision as much in every direction as what I can if I'm only doing the front side with a tummy tuck. And thus, the back side tends to be a little more lax than the front side. It is important to understand that over time, things will relax and you'll be able to stand up straight again. Basically, when you're able to stand up straight, we want to have a very nice result, which is why we pull things so tight in the first place. There is almost always a drainage tube that's used whether you have a tummy tuck or body contouring surgery. If you have a tummy tuck, the drain comes out through the pubic area and generally stays in place for about a week or two after surgery. The reason for the drainage tube is that there's a lot of area underneath the skin where the tissue is damaged, which tends to produce fluid afterwards until the tissue heals itself. That fluid can collect underneath the skin, commonly known as a seroma. And if we don't put the drainage tube, it's possible you get a fluid collection that we have to drain out here in the office. Sometimes we have to do that multiple times. Sometimes we'll take the drainage tube out a little too soon and you'll get a seroma even though we did use the drainage tube. The needle drainage isn't particularly uncomfortable. There will be some areas of sensory change, and some of those areas will be permanent. In other words, in sort of a triangular shaped area between the belly button and the lower incision itself, you will have an area where you lose sensation, and that will be permanent, will never come back. Some of the other areas of sensory change can be temporary, but usually if the sensation doesn't return within a year, it's not going to come back. With the body lift surgery, there are two drainage tubes. One drains the front side, the other drains the back side, and they generally come out through the upper hips. And again, usually stay in place for about a week or two after surgery. It's important to understand that there can be sensory changes. As I already mentioned, there can be scarring. There can be bleeding after any surgery. That bleeding can require sometimes further surgery in order to drain the blood collection and or to control the bleeding, although that's very uncommon. Again, we've talked about the risk of scarring associated with the procedure. There's always the risk of asymmetry, in which one side of your body where the scar is on a slightly different level than it is on the other side. The surgery itself is done under a general anesthetic, which means you're going to go off to sleep for the surgery. When you wake up, you'll be basically, again, flexed at the hips to about 90 degrees. You'll be in a compression garment that is to be worn day and night for 6 weeks after surgery. The reason for that compression garment is to help to decrease the risk of bruising and swelling that happens invariably after every surgery that we do. With liposuction, you'll notice that the majority of the swelling is gone after about 6 weeks, but it will take months before the final swelling resolves. The surgery, again, is done under general anesthetic, which means you're going to go off to sleep for the surgery. When you wake up, you will be in the compression garment. You'll go home that same day. It is important once you get home from the surgery that you be up moving around after surgery. Every hour or so, get up, go to the bathroom, get yourself something to eat. It's important that you're up moving around the house. You don't have to do that at night while you're sleeping, but if you're just laying around too much after surgery during the day, there's the risk of developing blood clots in your legs. Those can travel to your heart and lungs, and that can be fatal. We don't want to have that happen. And we do use compressive socks that you go home with, and we also use squeezy pumps during surgery to help decrease that risk. But it is important to understand that we're usually tightening the belly, which will make the blood return to the heart from the legs a little more difficult and increase the risk of developing those blood clots. That's why it's super important that you're up moving around after surgery. If you have risk factors that we deem are more than the average person, we sometimes will recommend that you have a blood thinning agent in addition to all of the other standard precautions that we take. Obviously, we don't give everyone blood thinners because it does increase the risk of postoperative bleeding, but if your risk factors are such, we may make that recommendation for you. The recovery period after a tummy tuck is such that you're going to need help getting up and around for the first few days after surgery. You will definitely be sore, and again, you'll have to walk bent over. Oftentimes, people will get a walker for the immediate postoperative time to help support their body while they're walking after surgery. This does occasionally cause pain in the back, obviously because you're bent over. That will tend to resolve as you're able to stand up straight again. And ultimately, sometimes tightening the core will help to decrease back pain in individuals who have chronic back pain, although we don't ever do the surgery for that specific reason. It's also important to understand that we're not doing this surgery for weight loss. While there is an inherent weight loss that is associated with the surgery, it's generally not hugely significant after surgery. So again, this is not a weight loss surgery, it's a body contouring surgery to make your body look better. After surgery, again, you'll need to relax and take it easy for about 6 weeks after surgery, in which we don't want to place tension on the incisions in which they can pop apart. After about 6 weeks, the scars have gotten the majority of their strength and you can resume your normal activities and gym activities. But I would recommend against doing any crunches or sit-ups if we've tightened the belly wall, because those stitches can pop and you can get a recurrent bulging of the belly wall. The stitches themselves are permanent, but after 2 to 3 months, the scar tissue should be significant enough that the stitches are no longer necessary and your newly tightened belly wall maintains itself. It is important to understand that the surgery itself is done to remove skin and fat that's on the outside of the belly wall. Occasionally, people will present with, especially if they're heavy or overweight, with fatty tissue that's on the inside of the belly wall. This is called visceral fat. While I can tighten the belly wall, if there's an excessive amount of fat inside the belly, it will push back against the belly wall, and over time the belly will tend to relax. Not to the point that it was before, but it certainly will not be as tight as what it was in the immediate postoperative period. Again, the more you can wear your compression garments and comply with the postoperative instructions, the better your result is going to be long term. If you have any questions or concerns about anything that I've said today, please don't hesitate to ask.